It is my pleasure to welcome today's speakers. Session moderator, Lori Heavey, VP of Marketing for ClearBalance. Patrice Talas is System Vice President Revenue Cycle, UPMC. Della Murdoch, System Director, Patient Financial Support Services, UPMC Pinnacle. Buffy Higgins, Senior Director of Rev Cycle at MaineGeneral Health. Sherry Liebel, Executive Director, Revenue Cycle for CentraCare Health. With that, Lori, I'll turn the presentation over to you.
Okay, thanks, Ashley, and thanks everyone for joining us today. I know many of you are wrestling with what could seem to be diametrically opposed forces. On the one hand, you're thinking about how to preserve market share by creating a loyal following of patients. And you do this, of course, by providing quality care, and more by finding ways to create a retail-like experience in all facets, not just care delivery, but in registration and on the back end of revenue cycle. Which brings me to the second force, or demand, which is the very real need to operate as a business and get fully reimbursed for services as quickly as possible. We have with us today representatives from 3 organizations, as you've heard: UPMC Pinnacle, MaineGeneral Health, and CentraCare Health. These folks have walked in your shoes to find the balance themselves between patient experience and patient pay reimbursement. You'll hear some commonality in their stories, but also some slight differences in terms of their motivation. At UPMC Pinnacle, for example, the idea of consumerism is one that they've been addressing for nearly a decade. At MaineGeneral Health, they're the largest employer in the area, so changes that they make are impactful not just to the community, but to their employee base as well. And CentraCare Health in Minnesota has been in the midst of acquiring other healthcare organizations over the past year or so, and balancing patient loyalty and reimbursement are priorities on top of bringing together several independent entities to operate as one. Let's first think about the idea of patient loyalty and how healthcare providers, and more specifically, revenue cycle, now is competing for consumer mindshare. But that's not necessarily a level playing field, as you guys really know. For starters, a trip to your healthcare facility isn't always planned, and with the exception perhaps of having a baby, it's not always a happy event. Yet the reality today is that consumers still want and expect an experience that's going to combine the best of Disney, Nordstrom's, Priceline maybe, Apple, and of course Amazon. I want a pleasant experience where you know me, where you can anticipate my needs, you make my interactions with your facility from check-in to check-out convenient and quick, you provide excellent customer service, and of course you're going to do all this for me at the best possible price. The good news is that we've made strides over the past several years. In our consumer research here at ClearBalance, we've definitely seen some shifts in consumers' perceptions related to healthcare cost. One of the biggest changes is that there's greater awareness among patients that they're likely going to incur some out-of-pocket costs. What they expect, though, is that you'll act in a retail manner to provide financing options. Another positive note here is that this actually can be a way to increase their loyalty and even lock them in for future services. That's because you've eliminated the cost barrier. If you think about it, studies show more than 1/3 of consumers delay or don't even seek care because they think they can't afford it. But by offering payment options such as long-term financing, where they can easily add on balances, you've made it more convenient for consumers to return to your facility, the next time they need care. So now that I've set the stage, I'm going to turn the conversation to Patty at UPMC Pinnacle, and then she'll be followed by Buffy Higgins to talk about what they're doing at MaineGeneral Health, and then Sherry will describe the strategy at CentraCare Health. So Patty, I'll turn it over to you.
Good afternoon. Hi, this is Patty Talas. They said I'm Assistant Vice President for Revenue Cycle here at UPMC Pinnacle. Very good. Well, Pennsylvania has a highly competitive market with several academic institutions and integrated delivery networks. Our organization itself has undergone significant operational changes, including an overhauling of our revenue cycle IT system and adding new facilities through South Central Pennsylvania. In September 2017, we joined UPMC, operating as UPMC Pinnacle. Today, we now comprise 7 acute care hospitals with 1,160 beds, 160 physician offices and ancillary facilities with more than 2,900 physicians and allied health professionals, and approximately 11,000 employees. So in total, I'm responsible for collecting a net patient revenue of over $1.8 billion and growing. Well before the concept of healthcare consumerism became a priority in our industry, we were engaging patients in a positive way to help them understand their healthcare costs and provide appropriate payment options. As mentioned, we started a while ago, and even though our collections weren't strong, it was still an idea of educating the patient. We embraced the idea of price transparency by posting standard charges in our website. UPMC Pinnacle also enables patients to get cost estimates, explore financial assistance and other financing options, contact a financial counselor, and pay bills online. These tactics are necessary and part of our comprehensive strategy for the patient's financial experience that keeps UPMC Pinnacle on the top of the mind in this competitive market. Initially, way back, we had actually started a homegrown module that provided average rates for commercial, Medicare, and self-pay, but we then were able to grow that more into a price transparency tool with a outside vendor, and we are now working further with our Epic system to develop it even further. This just gives you an image of what our UPMC Pinnacle website looks like and where the patient can launch their own personal estimate. That personal estimate does go out and query their healthcare benefits to see where they're at in their deductible and what any coinsurance or copayment would be for the service that they chose. In total, we have around just under 100 services that they can choose from to look at those, what their cost estimate will be. Providing estimates at pre-service and registration has been, as we said, a focus for a while now, for over a decade. However, the volume continues to grow due to complexity and increases in copay, deductible, and coinsurance amounts. Patients don't fully understand what they have in their insurance or what their deductibles are. We still do quite a bit of insurance and medical cost education while having conversations with patients. We're finding they're just not prepared. In our market, many consumers still are selecting the cheapest insurance coverage in terms of their monthly premium, and that just sets them up for higher out-of-pocket expenses. Nor are they prepared when it resets each year for that deductible, which in many cases increases as they choose different plans, and either they can make the payments or they can't. So we've done quite a bit of heavy lifting with our revenue cycle system conversion. We took advantage of that to ensure our new facilities that we brought onto our instance of Epic. We've gone from managing disparate facility to a single business office. We also did a lot of cross-training of our hospital and physician practice customer service staff, because it's now necessary for them to understand all aspects of patient billing with our combined bills. We are still bringing on new physician offices, so we continue to leverage this model to ease in the speed of transition. And we've also looked outward to improvements for the patient, including the patient statement. We now make the statement much easier for the patient to understand, clearly identify the different charges and what the patient has already paid. In addition to our traditional statements, we also make use of online statements and reminders through the Epic MyChart application, referred to at our organization as My Pinnacle Health, which is connected to our Epic patient accounting system. And also, once the patient opts into this method, they can be paperless. And that is also starting to catch on, which also decreases the costs of creating statements and mailing them. This screen gives you an image of an example of our statement, which shows the insurance payments and the patient payments, and then breaks out on what would be a second page their details by the physician's office that they see or the hospital that they visited, and also explains to them what part is a copay, deductible, coinsurance that they're responsible for. As I mentioned earlier, we've been proactive to conduct patient financial counseling pre-service and at registration. Our process includes creating work lists to focus on high-dollar service areas, including imaging and surgical procedures. We make use of pay-in-full upfront discounts to encourage pre-collection efforts, and our payers are fine with this as it's not advertised, and we clearly notified of this practice when we commenced on it. In the business office, we triage patient financial needs for financial assistance also, and as necessary, we also offer the zero-interest payment plans. We use a payment calculator to ensure patient payment plans are affordable and fall within our financial policy guidelines. We have been recognized within UPMC as, the area of in South Central Pennsylvania of, collecting much more than our other colleague facilities in Western Pennsylvania. So we're very proud of that. This schedule shows you our financial counselors' performance and how we track it by hospital and by staff person. One of our simple gauges for the financial counselors is based on meeting their budgeted goals. The amounts vary by hospital, as some of the financial counselors also perform inpatient insurance verification tasks, and the number of the staff at each of the hospital sites are different, as well as the expectation of the hospital market vary. In one of our markets, we have a large number of plain community folks, and this increases their goal. Also important that we motivate your team. We use friendly competition as a way to keep this important metric as a top focus. We share the month-end results by individual and rolled up by the location. We feel we have a finely tuned process, and in fact, as I said, we continue to outperform other divisions. My last slide talks about how we can focus on patient engagement and how focusing on patient engagement drives loyalty and financial performance. We continue to see extremely strong loyalty and performance measures for our long-term payment plan. According to a survey of UPMC Pinnacle patients who use long-term financing, 94% will return to UPMC Pinnacle and 90% will refer family and friends. 94% of the patients repaid their long-term financing accounts in full, preventing millions in bad debt write-offs each year, while also decreasing our days in AR. And the convenience of the payment plan also contributes to repeat business. Nearly 60% use the payment option for 2 or more procedures. And it's not uncommon for our patients just as soon as they get a bill to call in and request that they add it on, and that's no problem. It's something that really helps them balance their own personal budgets. Lori, that wraps up the UPMC Pinnacle part.
Okay, great. Thanks, Patty. So now let me turn it over to Buffy and Stacy with MaineGeneral Health. So, Buffy, you want to take it from here?
Hi, good afternoon. This is Buffy Higgins, and I have with me Stacy Russell, our Supervisor of Customer Service here at MaineGeneral. Thank you for having us. Just wanted to recognize Clear Balance has been one of the best decisions that we've made over the last few years in a big redesign that we have done with our revenue cycle. We had a large guarantor receivables that we needed a way to address. We had tried a couple of other strategies before Clear Balance, and what we found is that Clear Balance was incredibly successful for us. We weren't sure how it would be received by our community, but obviously it's been very well received, as evidenced by the award that we were recognized with. Just a little bit about MaineGeneral. We are in rural Maine, central Maine. We have a main campus in Augusta, the Alphons Center for Health, that has 192 beds. MaineGeneral produces about $1 billion in gross revenue, just over $1 billion, with about $450 million in net revenue. We have a comprehensive outpatient center in Waterville, which is about 15 minutes away from the hospital. And then we have about 65 sites, point-of-care sites, in our service area. which is about 88 cities and towns. We have about 250 physicians and 4,400, it says 43 in the slide, but we're up to 4,400 I just checked recently. So we are the largest private employer in the region, and as you said, many of our employees are our patients as well. So not only has ClearBalance been very well received in the community, but also by our very own employees. As I mentioned, we are the largest employer in the area and one of the largest employers in the state of Maine. We are the third largest health system. We are not affiliated with anyone. We're independent. And we had implemented the Cerner Sorian platform about 6 years ago, Stacy, 6 years ago. Mm-hmm. And so, as I said, we were struggling with our guarantor receivables and what strategy would be helpful. We did have payment plans, in-house payment plans here at MaineGeneral for our community members. We tried to adhere to strict guidelines, but of course we had to make a number of exceptions. Pretty significant amount of work for our customer service team. So as you can see in the slide, we have a great commitment to quality care and patient experience. We've won a number of clinical awards, and our patient experience was pretty good, but obviously our billing experience left a lot to be desired, unfortunately. So much of that had to do with the implementation of the new billing system. Quite a bit of it had to do with the shift in the industry to high deductible health plans. Folks in our area were not prepared for that shift. We had not prepared them for that well here at MaineGeneral either. So some of that was on us. You know, a lot of things are starting to change, as Patty mentioned, in the industry. We were not forward-thinking and out in front of that, so we've been playing catch-up. But it's great to see that there's a number of tools out there that we can all tap into, including, you know, the ClearBalance model. Like I said, it's been really terrific for us. So prior to implementing ClearBalance, just to give you a statistic, we were up around $33 million in guarantor AR, and just within a year, we have gotten down to below 20 million, which was a huge milestone for us. So kudos to Stacy's team on that, and I'll have her go into some detail as we move further along in the. So I'm going to introduce Stacy and have her speak to the operational benefits as well as the patient experience of, you know, once we implemented ClearBalance. Now, many people were unsure in our organization. We're very unsure of going with another vendor. We had, like I said, we had tried a number of strategies to reduce our guarantor AR, and we ran into some really difficult issues. Mainers typically are very set in their ways, especially Central Mainers, and they do not like change. So we had some things go sideways. Glad that this whole process has gone extremely well. Like I said, we had some folks that doubted whether or not this was going to be of benefit or would be embraced by our community members. So I'll let Stacy take it from there.
All right, so some of the things that we were hoping to accomplish with our self-pay balances was to make sure that we offered arrangements for our patients that were agreeable to them, but also to help with that AR balance that Buffy was talking about. Some of the feedback that we had received from our patients was that their deductibles were increasing year over year, and it was making it difficult to manage those larger balances. What we were looking for our patients were flexible repayment terms, but also a way to manage our guarantor balances in our system so that we didn't have continually growing AR. Yeah, so what we were looking for was to be able to offer to our patients a way for, the patient to be able to afford their balances and to affect our bottom line in a positive way. So the benefits that we've seen with the ClearBalance program is, first, from a patient standpoint, they really appreciated a more flexible repayment term that was zero cost, zero interest, and no credit check on their point. The other thing that patients found really convenient was the flexibility in hours and the ability to go online and manage their own balances so they could enter their own automatic payments. That was something that previously we weren't able to offer to our patients, so that was a huge win. The other thing that we found is we were able to redirect our work efforts to address other areas for opportunity within the customer service team. So overall, what we've found is we've had a reduction in some of the manual processes, we've had an increase in cash collection, and we've had a decrease in our bad debt. So some of the statistics that we've seen for impact, we were able to increase our outbound calls by about 65% by not having to manage the payment arrangements. We found that with the increased outbound calls, we were able to increase our cash collection each month from about $2 million to $2.5 million. We've also been able to increase our percentage of answered calls by 3%, and we've been able to allot 2 full-time employees who used to manage those payment arrangements over to other functions, such as helping patients understand their balances, their insurance benefits, and also to be able to do price estimates. So those are some of the shifts that we've been able to accomplish by shifting our payment arrangements over to Clear Balance.
As far as, what we did to prepare the community for this, because obviously we had seen some fallout from some previous decisions that we had made. Obviously our CEO, Chuck Hayes, he embraced this immediately, the Clear Balance opportunity. They took it to the board level. Obviously there was some robust conversation at the board level, given some things that we had tried. Wanted to make sure that everybody was supportive of going forward with Clear Balance. We communicated regularly through internal newsletters, external marketing efforts. The CEO advocated for it as part of his forums, his annual forums. We worked closely with the marketing department here at MaineGeneral, but also at Clear Balance. Having them in alignment was terrific. Clear Balance provided a number of resources for our marketing department, was very proactive. Like I said, we really wanted to make sure before we introduced this to the community that they would be well prepared for it, whether it was using social media or other venues to share that information. I think that's one of the reasons why it was well received by our employees and our patients, was because it wasn't a big surprise. And so Stacy shared a number of things about the efficiencies that her team gained on this slide. This is the redirecting staff to core revenue cycle project slide. And again, it's just so impressive, the progress that we've made. As I said, our CFO and our finance director just absolutely cannot believe. They're just so happy with the results of the Clear Balance initiative. On the next slide, just focusing on the patient experience across the spectrum. As I mentioned before, we're gaining ground in so many areas at MaineGeneral as far as our quality of care, other aspects of patient experience. We were doing really well. It's just so gratifying for those of us that have worked so hard to redesign this revenue cycle, to make it more efficient and effective, to see the results, and to have the community and our employees embrace the Clear Balance program. So it's, as you can see, in less than 6 months, I think Stacy shared some of these statistics with you already, but to see the collection rate improved, the ROI, which I think when we first sat down with Tom Cook, our rep at Clear Balance, and talked about ROI, I don't think, any of us ever really thought we would achieve the kind of ROI that we've achieved, and the reduction in bad debt and the reduction in the AR days. It's just been incredibly impressive. As far as MaineGeneral is concerned, it's just been a huge win-win. Like I said, it was a bit of a gamble at first, but it's been it's really paid off.
Great. Okay. Well, Buffy and Stacy, thanks so much. And I know we can talk a little bit more in the Q&A about how your strategies in patient engagement have made you more competitive with some of those people who were starting to creep down and maybe go to Boston. So maybe we'll circle back around to that in the Q&A. So next up, Sherry, I'd like you to, if you wouldn't mind going ahead and talking about your strategy there at CentraCare.
Yes, thank you. Like Lori said earlier, this is CentraCare. I represent CentraCare. We are centrally located in Minnesota. We have a large delivery network of 8 hospitals and a number of clinics, senior housing, and long-term care facilities. In our makeup of our geography, we also have a number of critical access and rural health care, so we serve a large majority of rural clients within our system. We also have a subsidiary called Caris Health, which actually serves the west central and southwest portion of Minnesota for us. So overall, we have about 13,000 employees, pretty close to 13,000 employees for our system. So we have a great large geographic area. As Lori alluded to earlier, we are going through a lot of growth in CentraCare. So in 2018, we formed Caris Health, which, like stated earlier, it's a subsidiary of the CentraCare proper. With that comes, originally it came with a PPS hospital and a surgery center, and very quickly it grew to additional 10 clinics. And then we also brought on a rural health care clinic and a critical access hospital. And that area for us continues to grow today with more organizations coming on in the very near future. So with that is growing pains, and how do we continue to leverage ourselves? How do we continue to maintain and keep our market share, but also remain competitive and grow that market share as well? So we've been focusing a lot on standardization and trying to figure out standard processes that work best for our organization as a whole, and then really leveraging different pieces of revenue cycle throughout both CentraCare and Caris to kind of help with maintaining that market share. The other key component is like I stated, we are in a number of rural communities, so we want to make sure that even though we are a large organization and we are continuing to grow and we have the big organization mindset, to our patients we continue to look and feel as if we are their small town healthcare organization and we're really part of their community. So we really want to assure that our patients understand that we're listening to them and then we're serving them. We're there to help guide and heal their entire continuum of care, and that they really understand how much their health means to us. And so we continue to work towards that goal while still maintaining the competitive edge, and we're hoping that that small town feel is really the edge that we're bringing forward. Also impactful for us is assuring that our patients truly do understand everything we're doing. So helping them understand what the cost to them is to receive the care in the organization as a whole, and educating our patients to assure that they have that understanding, but then also we have the tools available to give to them to help them pay for their services if there is options, if they're out of options to do some of those things. So some of the projects that we will be working on and we are embarking on and working on for the next couple of years is obviously integration. We want our patients to have the same experience no matter where they go. We want them to feel comfortable with that experience and not have some differentiation, which has been happening over the course of many years. So we've been integrating for about 5 years, and we're going to continue to integrate until we, from the revenue cycle perspective, have that really solid edge on what that looks like. So we're building a structure to allow for further growth, but then not disrupting how we are working with our patients and what the patients are seeing from the outside. One of our main projects and goals over the course of the next couple of years is assuring that we are transparent with what the patient owes, so providing those patient estimates at the forefront. So currently, as part of our integration, we are working on restructuring our pre-registration area so that we can grow that throughout the system. And within pre-registration, we can actually provide patient estimates as far as what their out-of-pocket is, and then also provide some financial counseling to those patients so that they have options, and within that allow us to look at the payment plans for them, Medicaid enrollment, what have you. ClearBalance has been very helpful as we are working through financial counseling from the back end, but we want to move a lot more of that to the front end, and rather than waiting until a statement is actually dropping. The other goal that we have is to actually provide those online estimates to the patient, and they can start thinking on the forefront of how they're going to be able to pay this. And then we've already marketed our ClearBalance very well, and so a lot of our patients are calling up already asking, can I please move this on to this balance? So really prepping them and continuing to educate them on what their responsibility is, but then also what are their options for payment and how can they make this work for them. Some things that we've already implemented similar to UPMC is we do have the paperless option. We're really working to make sure that our younger generation who does everything via phone or other forms of technology, that they can receive their statements paperless and that they can actually pay their bills online. So we too are utilizing MyChart to kind of help us do that, and then strategically placing our options within MyChart so patients understand how they can also pay for their services if they need additional time to do so. There's a few other things in here that some of the standard work and processes that we're working on from revenue cycle that do impact our overall. Our goal is to actually move a lot more of the function from the back end to the front end and to help with some of that transparency to the patient. In order to do that, we need to get a handle on some of our other work that is being done, such as denials management. So really working on creating that denials team to kind of help so we have staff. We can better leverage our staff and move them to more meaningful work, not that denials isn't, because it is, but move them into some work that would get us some of that money on the front end as well. Also utilizing technology. So we are currently utilizing a predictive analytics tool to help us get some of our missing charges in on time. So we are leveraging that to build some of our Revenue Guardian in Epic and then claim edits and companion guides. With that, if we don't have folks chasing charges, we then have the opportunity to start shifting work into more forward-fronting positions. Also leveraging artificial intelligence to do things such as claim status checks, prior authorizations, those types of work. So then we can release some of that staff who are doing some of that redundant work to actually move them to the front and start working some of this on the front end rather than us chasing the dollars on the back end. So really, what does success look like? It really is more about being there for the patient and helping the patient really understand what options they have. And then our theory here is really if we can help them with their financial health and understanding that and cleaning that up before they actually come in for the service, that actually will help them recover on the end much faster because that's one less stressor that they actually have to worry about. So we've already piloted some projects within CentraCare, one of them being financial counseling and education. So this is a little bit separate from the pre-registration perspective. We had determined within CentraCare that an area that could really use some additional financial counseling would be in our OB area or obstetrics area. We have a very diverse population that we serve in our obstetrics department, but also we have a population that is self-pay, and we needed to address that. Interestingly enough, we were able to engage the department to help us place that financial counselor in rather quickly when they started to see how much money we were writing off because we were not collecting, or it was going to bad debt actually, because we were not collecting on circumcision. They had an initiative to say, how can we get this money in the door for circumcisions for our self-pay patients or our Medicaid patients? That really pushed the envelope for them to say, yes, we want a financial counselor in our department. So working with the department to give us space to allow that financial counselor to sit there, first of all, and then also working with them to say, you know, we really want that financial counselor to see the patient prior to the appointment rather than after the fact, because we were afraid the patient would not stick around. So actually building a schedule and allowing the patient financial counselor to visit with the patient in advance. This has been helpful because now we can start talking about how we can help them pay for their services prior to them having the baby. We can also educate them on what are the options once you do have that child. So getting that baby on some form of a financial, or getting that baby on some sort of a coverage, whether it's the commercial coverage they have today, maybe it's a Medicaid program, or again, having those conversations to say, how can we put you on payment plans and help you through this process? And also doing a level of upfront collections based off of the estimates. So that has been a project that we piloted in OB. It's been very successful, and now we are looking at other departments where we might need to actually physically place a financial counselor so that they can meet with those patients on those times, at the time of their visit. Department education and engagement is always powerful once they start to see how much money we're not collecting, whether it be for denials or whether it be because we're sending them to bad debt. So we really started to engage the departments when we started working on denials. So we created a denials dashboard and the whole 9 yards. And then they quickly said, well, I want to see what our write-offs are. So we've been engaging them, and they're starting to learn what their financial health of their department is. And with that engagement, then it helps us move into other opportunities to say, this is why we need financial counselors in your areas, or this is why we need to start having those conversations with the patients on the forefront rather than waiting until the end. So some of the goals that we are looking at as we continue to work down our process of integration and changing our revenue cycle is obviously pre-service collections. How much money can we get on the front end? How can we work through this on the front end? Obviously, we're looking at our cash flow, our self-pay rates, and our bad debt expense, and really wanting those things to start to level out and actually decrease in many of the areas. So in a year, since we've engaged in a number of projects, and Clear Balance being one of them, we have seen a decrease in our denial rate. Our pilot with our obstetrics area, we saw an increase in point of service collections by 25%. And a really nice one that we've seen is that we've started to see our bad debt reduce simply because we have other options out there, and patients are willing to start having those conversations when they see that there's a loan program that's available to them. And our AR has definitely reduced as well. So our overall ROI from the program, it's been 350% plus. Our patients are very engaged. I'll tell you one thing that I think helped us out quite a bit. We had some of our patient account reps actually utilize the Clear Balance loan program when we first enrolled, and it was very, very beneficial because they were able to then speak to the patient about how great of a program it was and how easy it was to use, and that was really beneficial. So we have patients that are continually calling saying, can I add this balance to that? They're referring to their friends, so on and so forth. So I think it's been a great program. It's a nice offer to our patients, something that we didn't have in the past, but it's really helped our organization, but it's also helped our patients, which is first and foremost. So we've been very thankful and grateful for the program. With that, I will turn it over to Ashley.
Thank you all for that engaging presentation. If you have questions, please enter them in the Q&A box located on your computer screen. For the first question, UPMC Pinnacle, do you guys still conduct cross-training today between the hospital and physician groups? What areas do you focus on most?
Well, what happens is this: when we originally went live on Epic, which was back in October of 2016, we had to combine the two customer service areas. And so that was where the cross-training had to occur for a period of time. Now when we hire the individuals, new staff in, they go through a long period of time of cross-training. Della, you're also on the line. Why don't you even add a little bit more as to how that training occurs?
Yeah, so we actually have an internal trainer which really helps with the Epic process to teach the new customer service reps both the hospital side of billing and also the physician side of billing, because they really do operate as a single business office, and having no matter where the patient goes to our facility, it goes all onto one bill, which is great for the patient. Instead of them receiving multiple bills from the same company, the customer service staff has to be able to answer both sides.
And this is Patty Talent again. I just want to add, too, just to make further clarification. We do still have split between the professional, the PB, which is referred to in Epic, and HB when it comes to the insurance claim. So the production of our 1500s for our physician corporations and the production of the UB04 for purposes of the hospital facilities is still two separate departments with two separate directors. Della's role as System Director of Patient Financial Services is really related to the patient billing. That is where it's combined. And the customer service side of that, which is answering the calls from the patients and some of the financial counseling, too.
UPMC Pinnacle, do you measure the accuracy of your cost estimation tool? If so, how accurate is your estimator?
Della, we don't really have an accuracy check per se, but we do somewhat monitor it. I know that it's been looked at previously. Do you have any update from the one vendor?
Correct. We don't monitor it 100%, but our financial counselors that have been doing the job and giving these estimates for a while, they are pretty keen on what these estimates should be coming back at, and they know if they put something in and if it's totally out of the ballpark. But, we don't get a whole bunch of complaints, and pretty much if we're really far off, the patients will call in and complain about it, even if we're over or under. So we don't have a ton of that, so our accuracy rate can't be that far off. But no, we don't have an official tracking that we do.
And just to add to that, too, as part of our Epic process, is that, as I had mentioned, we do provide an upfront discount if the patient pays prior to or up to the date of service. That discount continues to be recognized on the account, whether they over or underpay. So if they overpay, we make sure that we don't refund them something that was in excess of the amount that they paid as a percentage. But if they owe more, that 20% additional discount is still added on a subsequent amount due for that service, because it's not their fault the estimate was off.
That's correct. And as we convert over to doing an estimator within the Epic software, we should be able to get much more and better reporting that way.
Right. Good point.
Okay, next question. Do you have two different self-paid discounts? One if the patient pays in full on the date of service versus if they pay later on?
For the patient out-of-pocket amount after insurance, that percentage is still the same. So there's no discount to the out-of-pocket amount unless they're applying for financial assistance under our financial assistance policy. that would be different. In addition, there are self-pay discounts outside of the financial assistance policy that is automatically granted for those individuals who are uninsured.
Next question, MaineGeneral Health. When you're working with local employers, what are the greatest concerns they have?
Obviously, working with local employers, compensation, including benefits, is their biggest expense. So they want to ensure that they can keep that affordable. You know, we do have a workplace health program here at MaineGeneral that contracts with local employers, helps to keep their workforce healthy. We have fitness coaches, if you will, that go and visit each site. But obviously local employers want to make sure they get, you know, the best pricing that they can get. Those that are contracted with other payers, you know, they've employed some strategies lately to try and steer their employees to other standalone facilities to keep the prices down. And what we have continued to lean on is the loyalty that patients have towards MaineGeneral and their experience, their past experiences. So patient loyalty is a big part of that. But definitely employers in the area and MaineGeneral itself is constantly looking at the cost of health care and how that impacts the business, the organization. So I hope that answers your question.
Thank you. We do have another question. What about underinsured policies, reference-based pricing, assignment of benefit, Christian ministries, exhausted benefits, out-of-network, same self-pay discount as uninsured?
Patty and Della, I think this question probably is back to you.
Okay. So I guess I'm not understanding all the categories. For instance, like Christian ministries, and Della, you can chime in. I mean, I know that we will take those through financial assistance if they need, I mean, because they would fall under, quote, uninsured. But Della, do you want to add on some of those other categories?
Yeah, if they're uninsured, we're going to give them a self-pay discount. And again, they can all apply for charity care. If they're underinsured, they can also apply for charity care as well. However, we pretty much base it on either you qualify at 100% getting charity care or not at all when a patient is underinsured. We did change our percentages a year or so back because we had a lot of the Medicare patients that were not qualifying just by a little bit, and they, you know, are on fixed incomes. And now that we changed the percentage, they actually almost probably 98% of the Medicare patients, if they fill out the charity care application, actually qualify for the charity care now.
And I'm more than welcome, I mean, any of the individuals on the phone. UPMC Pinnacle does have a separate website from the rest of UPMC just because of our distance from Pittsburgh and the number of facilities we have in South Central Pennsylvania. And our financial assistance policies and credit collection policies are different than the rest of UPMC. So if you look out there on our website, they're there. So if you want to see the details as to, you know, what's all included in the percentages, feel free to check it out.
Next question, CentraCare Health. What has been the most challenging to integrating different revenue cycle teams?
Oh, there's a lot. I guess the most challenging perhaps has been buy-in for the most part from the facilities that we are trying to integrate. So some facilities haven't maybe been quite as willing to want to release some of that security by having the staff report up through them. But as we have worked through some of the integrations we've had so far, it's been very beneficial. They've seen the benefits from those that we've already integrated, but it continues to be a problem. So I think one of the things is really engaging departments that may have had some level of revenue cycle within their departments before, engaging them on the very forefront and having those conversations with them and really helping them understand how we can assist them rather than making them feel like we are taking an arm away from them. Many of these individuals may wear more than one hat, so really deciphering what part of their job is revenue cycle versus maybe an admin assistant versus maybe a clinical assistant type piece. So that's been kind of the challenging part to this time, but I think we've done it enough now. We are working towards our 6th integration, I think, right now. So really understanding who your stakeholders are and bringing them at the table in the very forefront has been very beneficial.
How do you track the financial counselors or financial case managers' productivity? AR, insurance enrollments, financial assistant enrollments, etc.
So I think all three of you could probably answer this question. So why don't we take it, Sherry, why don't you talk about it from your standpoint, and then Buffy and Stacy for you guys, and then Della and Patty, you can wrap up, just kind of refresh from what you had described earlier.
Yeah, so from the CentraCare perspective, we do have reports to see how our financial counselors are actually doing as far as bringing in money from at point of service or what have you. We're very much so in the infancy of it right now, so we're still learning. So I was excited to listen to Pinnacle to hear what they're doing. But I think we do have some reports to see how our financial counselors are producing. We're also utilizing some Epic technology for productivity. So we're working through that right now as well to kind of help us gauge how they're doing, and then reporting is key. You know, anything that you can put into your system and develop a report out of, that's truly key, where we can constantly measure how they're doing and their success. Also, one other thing to know is we haven't done it yet. We haven't found the right report, but one of the things is actually turning our self-pays or reporting on our self-pays that haven't gone to bad debt, so really measuring that, and then turning our self-pays from those that wouldn't previously been on payment plans to those that either went to payment plans or we turned them on to an MA or Medicaid or a financial assistance program.
Buffy and Stacy, what about for you guys?
We track all the productivity of all of our teams. We have a dedicated revenue cycle analyst that does a lot of our metrics, our reporting. The financial counselors have been very busy in the last 6 months. We had a massive expansion of MaineCare here in the state of Maine. So enrolling all of those community members into the MaineCare program took up a significant amount of their time. Prior to that, we had the ACA and the marketplace, and our financial counselors had gotten certified to be able to enroll community members in the marketplace. But we recently had a conversation, and we think, you know, this is the nature of change in the revenue cycle, is that as that has gone away and that requirement is no longer legislated, their roles will change, and they have been focusing more on that MaineCare expansion. So I know they've been tracking, you know, again, the same thing, the dollars of charity care that have been significantly reduced because of the expansion of MaineCare, and also the reduction of bad debt. So we have these productivity reports that we receive as leaders in the revenue cycle for each one of our teams, as far as, you know, the amount of work that they're doing, the kinds of work, the conversions, the reduction of the charity care and the bad debt. Am I missing anything, Stacy?
No, I know a lot of the reports are financial based. So one of the reports, for example, is the number of patients who had originally gone to bad debt, who now we've been able to convert over to MaineCare. So we track all of the metrics as far as the financial counselors' productivity and financial transactions.
But I loved what Sherry had to say earlier about shifting more of that work to the front, and that's exactly the same kind of strategy that we'll be embarking on as well.
Thanks. And then Patty and Della, if you want to answer the question finally, and then Actually, given the time, I'm supposing this is probably the last question we have time to answer, right?
Correct.
So, Patty and Della?
Yeah, the only thing I wanted to add is this is Patty. I just wanted to add that report, that portion of the report that was in the presentation only represents the financial counselors, and they're really targeting the high dollar scheduled and surgeries. But we actually have all of our registrars, whether it's a walk-in imaging, walk-in lab, especially now in the ED, we have even a stronger initiative because we knew there was staff that wasn't asking at all, and it's actually been pointed out to them that it's in their job description. So we have been pushing it much harder even on the registration side, that they continue to use the same tools that are available to the financial counselors. And so the same report that Della showed for her financial counselors, we actually get that same detail out to our Director of Patient Access so she can monitor by department and then her managers within their areas by staff person so they can see who's performing better than the others, and they can do a little bit of counseling and coaching for those employees who definitely aren't asking anyone. And that has made a big turn. This month, we actually are really excited that we've had our first month of 23% of our patient collections came up front versus coming by patient statement. We were hanging around 20, and now we're up to 23%. So we're very excited and hope to continue that trend.
Lori, do you have any closing remarks?
No, in the interest of time, just thanks everyone for joining us, and thanks again to our speakers from UPMC Pinnacle, MaineGeneral Health, and CentraCare Health. You know, as I said at the beginning, there's a lot of commonality in what everybody is trying to stay top of mind with, putting the patient first as always, and then doing it within the nuances of what your market demands are. So great to hear all of your stories.
We have reached the conclusion of today's webinar presentation. I would like to thank our speakers for presenting and ClearBalance for sponsoring this very timely presentation. We hope you have found this presentation informative. Please remember to complete the online evaluation within 2 days after the webinar. Your feedback is important and helps plan future programs. If you have further questions about this webinar, you may email them to HFMA's Resource Center at resourcecenter@hfma.org. Our Resource Center staff will assist with questions not answered during this webinar. Thank you for your participation and have a great day.